The federal government is offering $50 billion to states for new ideas to transform rural health care. It's a challenge EMS departments in these Texas counties know all too well.
Our Dylan McKim spoke with the heads of 3 of those departments about the challenges they face day to day and the ideas they have to change the future of rural health care.
EMS departments in rural counties face unique challenges. In a state like Texas, one of the biggest challenges is distance. In Lavaca and Colorado counties, there are 8 trucks servicing about 2,000 square miles for 911 calls. But they also handle patient transfers from nearby hospitals to higher levels of care.
Where is the next higher level of care? It's about an hour and a half either direction.
That's taking an ambulance out of the local service area for hours. In Karnes County, a rural area between San Antonio and Corpus Christi, the EMS chief says his 3 ambulances routinely drive long distances for 911 calls.
About 40% of that goes directly to San Antonio for either medical specialties, cardiac stroke care, or obviously trauma.
In 2023, Karnes County spent 86 hours out of the entire year with 0 ambulances in the local service area. Out in West Texas, in the town of Seminole, it's the same problems with an even smaller staff.
So in rural America, we're transitioning from a volunteer type agency to a paid type agency. And because of the lack of funding, it's hard to pay our staff.
To face these challenges, these EMS professionals are looking at ways to provide care to someone at their home rather than taking them to a hospital. One idea is to utilize telehealth.
I can take the iPad while I'm there with them, or my paramedics and EMTs are there with the patient, and I can connect that patient immediately on the iPad with the physician.
That's just one example of an idea being presented to the state, which is applying for a share of $50 billion to transform rural health, something professionals say needs to happen sooner rather than later.
It may not affect you directly today, but when you and your loved ones are traveling through the state, chances are that rural healthcare is going to come into play somewhere for you.
In Austin, I'm Dylan McKim.
Earlier this month, Governor Greg Abbott signed 2 bills to improve health care in rural Texas. One creates a state office of rural hospital finance. It would help hospitals have the resources to support their patients and create a financial vulnerability index. It would also establish the Texas Rural Hospital Officers Academy to offer training on financial stability, plus create a new grant program focused on hospitals in those areas. House Bill 3000 creates a new state grant program offering money to help rural counties buy new ambulances.